Hi, Dr. Tracy. I'm a board-certified general pediatrician living in Vermont, and there are now over 1,000 of you that are following me on TikTok. I started this about a month ago after being at a medical conference for advocacy for children. The American Association of Pediatrics has an annual leadership conference, and they talked about how over 80% of parents right now are getting their information from social media, but that the majority of them still trust their pediatrician to be an expert in their child's health care. And so it got me thinking, if the majority of people still do trust their pediatrician, but they don't have great access to them to get day-to-day health information, then it's not wrong or unethical of me to get on here and try to help. So one thing I pride myself on is education. I feel like I'm easy to talk to. I will answer any question that people ask me. And if I can do that for one little bit of the internet and help a few more people feel less lost in the world of trying to get information about their children's health, then I am here for it. So a little bit about me. I'm 49. I've been a general pediatrician for over 23 years now. I grew up in Florida, so I trained at the University of Florida in nutritional science as an undergrad. I did a year of research and working as a licensed nursing assistant, which I absolutely loved. It was a great segue into going into medical school. I went to medical school at the University of South Florida in Tampa, and I did my general pediatric residency at the University of South Florida in Tampa as well, at All Children's Hospital in Tampa General. Amazing experience, some of the absolute best attendings and professors in the country, and it was a wonderful experience. My husband is also a general pediatrician. He works in the same office here with me in Vermont. I have 2 children. My oldest daughter is 19 and my son is 16. I have 3 dogs and 3 cats, and I live in rural Vermont now. We moved here during the pandemic, and we just wanted a different change of pace for our kids and to try to see the country a little bit more and show them different ways of living and different experiences. And I just kind of felt like making a change. I think a lot of people made a change during the pandemic, and it's been really good for us as a family. So I am really passionate about special needs. I'm very passionate about mental health. I'm very passionate about parenting, education, public health now. I think I've really realized since being up in here in Vermont, where we have such a large kind of universal almost healthcare system for children, how much public health impacts children's health overall. And it's made me even more passionate about the policies that we choose to engage with as a country on how to improve the health of our kids. So I want you to know who you're talking to. I really appreciate your trust. I understand that it's not easy to come by these days. Feel free to ask me questions, and I'm happy to engage as best I can. I can't give, obviously, personal advice, but I'm happy to give as much advice as I can. So please feel free to leave comments. I am happy to help in any way that I can. So take care. A few things I'll give you to notice how to know what you're looking at on the internet. Look at the person's credentials. See if there's someone who might be an expert in that field. I myself get duped all the time by seeing something, going, oh my gosh, that sounds interesting or amazing. And then I'm like, oh, this study that they're talking about doesn't exist, or they don't have any studies, they don't have any background for that. And I look it up and it's actually not true. So be careful what you look at. Check their credentials. Check if they're selling something. It's not always wrong to be selling something, but in general, especially when it comes to healthcare, we're held to a really high standard. And so we can't sell something in order to make money off of you while giving medical advice. And most of us that are medical providers here on social media that are actively practicing medicine, you'll notice we're not trying to sell you anything. I do this for free. I do this on my administrative day, which is why you see me in my kitchen with no makeup on, or at the very end of the day. If you see any makeup, it's usually at the end of the day when I have to work. So it's just something I feel passionate about. It keeps me from other things in my work. I really need to finish my notes. So I'm sure my office managers, please saying get off TikTok and do your notes. But I think this is really important right now. I think we're at a crossroads in healthcare and public health. And if we don't start to make a dent, we're going to go decades before we're able to catch back up to where we are. So pay attention to what sources you're looking at. Be critical, be thoughtful about them. Don't spread something unless you know that it's true. Even if it seems interesting, I read stuff all the time and I think, oh, this is kind of interesting. I don't share it right away. And when I have, I've been really sorry that I did. So be careful what you share. Be careful who you are taking advice from. Look at their credentials, see what their incentives are, and see if you can do a little bit of digging yourself to see do they have any evidence behind it. And so I hope this helps. I hope this little place of the internet can be a place where you can get information and feel heard and understood and have a little bit better communication style with your own provider. So take care.